hello everyone. We're just absolutely delighted to be here. So I'm Dana Colbourne. I don't think I can introduce myself better than Sue did, so thank you for that, Sue. I'll hand you over to my younger colleague. She is my quick mind, I like to call Sam.
So I'm Sam Perry. Yes, do lots of different things. You're right, Sue. I don't always have time for all of it, but I try my best. And I think if you're going to do something, do it right. And I love student voice, so getting involved in anything that represents and speaks for students is at my core. So being a representative for the Student Midwife Forum with the RCM and being president of the Midwifery Society, these are all things that help me spread student voice.
Lovely. Thank you, Sam. So what we are going to share between us is a short PowerPoint, and we're going to basically sort of describe the clinic. So I can obviously give a practice supervisor and a project lead perspective, and Sam is going to bring the lovely student perspective, and we've got some lovely feedback from the women that have attended the clinic as well. So if you just give me a moment, I'm just going to quickly share my screen. Brilliant. Okay, so yeah, thank you so much for having us. So we're going to be talking about initiative that actually happened a decade ago. I want to say a big thank you to Wendy Marsh, because she was the brains behind the initial project many moons ago, when we first trialled it in Portsmouth Hospital Trust along with Bournemouth University. And little did I know that it is still very relevant today, but also how hard it is to get a project going in the NHS for a long period of time. And the reason why I've kept going is I really do believe in it, and hopefully you will see the benefits as we go through this PowerPoint and the discussion. So the SMiLE clinic, it actually stands for Student Midwife Integrated Learning Environment. It is in the form of a postnatal clinic, and it is a form of CLIP in the form of a student-led clinic. And I was lucky enough to be part of that back in 2013 in Portsmouth hospitals. And again, like I said, 10 years on, I'm at Southampton hospitals, and we've learned a lot along the way. So I would say it's evolved. So some of the topics we're going to cover tonight is we're going to introduce you to the SMiLE clinic. We're going to look at the operation of the SMiLE clinic. I'm going to give you some statistics from round about September through to January when the pilot project ran. We're going to look at some service user feedback. Obviously, Sam was going to give us some lovely student feedback and her own perspective of being one of the very first students in the project at Southampton. I can share some of the practice supervisor, because obviously it's not just me, we work as a team, but also some of the benefits, and most importantly, the challenges. I think when you're doing a project, it's so easy just to look at the benefits, but actually the challenges is where you learn the most and where you do those improvements. So that is going to be really, really important. And also, we don't know everything, as the service changes, as midwifery changes, the clinic has to evolve alongside that as well. So we're always going to face some challenges. And then hopefully we can take some questions from various people. So, as I said, the SMiLE clinic is a CLIP model of learning, and it allows students to lead in their learning and the care in a safe space. And that is really, really important. So what we did when we looked at the models, we actually got the idea from our American colleagues. It is a model that's used a lot in medical students' education, but that is not the primary use. Student-led clinics or free-run clinics came about to actually fill a gap for uninsured people out in the United States and Canada and certain countries that don't have a healthcare system like us. So that was a primary function, really, of student-led clinics. And then it soon became apparent that actually it gave so much more. It was a really a good educational tool. And there's been quite a few studies out there now that have looked at the benefits of students and their progression and their confidence if they've actually been part of a student-led clinic model of learning. People sometimes get a little bit anxious because when we say student-led clinics, they obviously just think that we're going to send a bunch of students in that are not facilitated in any shape or form, and that is absolutely not the case. You know, the students are nurtured by a qualified midwife that is a practice supervisor and that has got quite a few years experience in the domain that you would perhaps want to set the student-led clinic up. In this instance, we have started with a postnatal clinic. You know, sometimes you have to risk assess the different areas and just see, actually, at the start of a project, you know, what do we want to do? We probably want to go for a lower risk environment, and postnatal was probably the best environment to start that project off in. But as you'll notice as we go through the PowerPoint, there is a lot of flexibility in student-led clinic and the way you can design them. Now, this is a really important aspect of SMiLE. It's the ethos of the SMiLE clinic. And again, you know, one of the challenges, that people sometimes didn't quite understand what we were trying to do. It's not just running a clinic. It's not about that. And I think this really stemmed back from my own personal time as a student. I had a great experience. And I would say the majority of people I worked with as mentors, because they were called mentors back then, they were really helpful and really nurturing. However, I did have a few episodes where I didn't have very positive experiences. And I really learnt from them, because when I did go into education, I always remembered how I felt when someone didn't treat me perhaps how they should have treated me. And what I also observed is that if you provide a really nurturing, kind, respectful and work in partnership, you get the best out of people. You know, people feel safe. They feel psychologically safe to really, you know, ask those questions. There's no such thing as a silly question. I don't know if you want to jump in, Sam, and just have a few words.
Yeah, absolutely. You know, that ethos comes through as a student at the SMiLE clinic. Yeah, as you say, you know, you have positive, mostly experiences with supervisors on placement, and every so often you find someone who you can just tell doesn't really want to have a student with them. You know, perhaps sees a student as a burden rather than an opportunity to, you know, pass on so much great knowledge. And yeah, you come into the SMiLE clinic, and I always say to people, it's kind of like walking into a hug. It's great. You know, it's a lovely environment. As you said, that psychologically safe space, and you know that the team are there to support you in everything you do, and you feel able to, you know, just push your limits in terms of like what you're able to feel you're comfortable in. And you know that you've got that safety net. You know that you know if you're not sure of something, you're going to go ask someone, because you know they're not going to judge you for that. They're not going to say something funny about it. They're just going to help you. That's great.
Yeah, and you know, it was really important, because I think one thing I've noticed in my time in midwifery, with the student and being a registered midwife, there can be a feeling of a real sort of authoritative hierarchy. And again, I don't think you get the best out of people. Obviously, there has to be a structure, you know, there has to be leaders, there has to be managers. However, I also think that, you know, the majority of our students are mature students coming through the door. They come with an array of experience. And also, you know, I just feel that a lot of what they know is transferable to midwifery care and the profession. And I really sort of want to unpick that. But also they will teach me as much as I can teach them. So, you know, partnership is really, really important. And that's quite a strict ethos, you know, so the right practice supervision is crucial in the SMiLE clinic. It's not just about running a postnatal clinic. So how does the SMiLE clinic operate? Well, again, this can be flexible. So if you're out there and you're thinking, oh, okay, I quite like this idea, you know, it can be adaptable and fit into different types of services. So at the moment it runs Monday to Friday. So this is the information from our pilot study, 9 o'clock to 5 o'clock, and we're working from the New Forest Birth Centre at the moment. So we have stunning views over the forest. We often have New Forest ponies walking past. It is a beautiful location, especially for women to come and see us and perhaps have a little bit of TLC as well. There's usually 4 students, mixed ability, per placement. They have a 2-week placement with us. We have 2 rooms, so we have 2 clinical rooms that we can see women in, and we also have part of a ward that we've made a little breastfeeding hub, and well, infant feeding hub, shall I say, because everyone is welcome. We're very, very inclusive, and they can come if they're having any feeding issues, and we look after them with providing obviously some lovely BFI information. We make them a cup of tea, they have a biscuit, you know, they really, really do get cared for. And we just really speak to them and take a real interest in how they're feeling after they've had their baby. So as you can see, you know, we do have capacities to see quite a few women. Okay. And the beauty of that is the fact that we have got more bodies around, but everything that is happening in the SMiLE clinic, every woman that comes in will come in perhaps with some different issues, challenges. So the learning opportunities are huge. And the problem that we were seeing was the fact that the maternity support workers were taking vast amounts of our postnatal care. And I remember, you know, and this isn't just recent, this has been going on for years and years. And I thank them for that, because at the time the workload was absolutely huge. But the challenge on from that was the fact that students were not getting routine postnatal care opportunities. So we started seeing students with really low EU numbers that they have to have, as you well know. And we were a bit like, oh, bemused by that, because when I trained, it was very easy to get lots of routine postnatal care opportunities. So, you know, this was a big driver for the educational focus of the SMiLE clinic as well. And it gives students a lot of different opportunities in how we care for women and babies in the postnatal period. Like I said, we can carry out extra tasks like infant feeding support. We have a little bit more time for other assessments. So we could do some mental health assessments, work with the multidisciplinary team. And also we can do telephone calls. So we can check up on women that perhaps don't need to come in or home visit, but they can we can just check up on them on the phone as well. So let's talk statistics. So in a pilot project, you know, people always like to see the numbers. And this is just a small sample, really. So this is from the September up to January 2023. So by this time, we were 10 weeks in operation if you take out some leave. And as you can see, I'm not going to read all of them out, that you can see how many women we saw, you know, the babies that were weighed, the newborn blood spots that were taken, babies that needed, you know, some active assessing for jaundice, infant support, and also women that needed emotional support. And because COVID had happened, postnatal care had really changed. And I think a lot of people started seeing phone calls as the norm, you know, no face-to-face contact. And it was like, just because we've been doing it, it was the right thing to do, when actually, when we started the project, we soon realized that it wasn't the right thing to do. These women needed contact, you know, they needed face-to-face contact with health professionals. They needed, you know, just that support, that emotional support, and being in a safe space where they could talk and they could be looked after. Also, what we started to see is that there were some babies that had significant weight loss round about at day 8 and 9, which I hadn't really come across in my career as a community midwife, because we were seeing them so regular. We tend to pick really up really quickly. And And that was a worry. And I think that was the hangover from COVID as well, where there was lack of breastfeeding support in particular, but also just lack of contact to the health professionals, to the women as well. What it also gives is it gives the students real opportunity to work in a collaborative manner with other health professionals as well. So we do a lot of collaborative work in the SMiLE clinic as well. So Sam, I'm going to hand over to you for some student feedback, if that's okay.
Lovely stuff. Oh, you didn't put my blood spot on there, though, did you?
It probably was yours, Sam, to be fair.
So there's the photo of a newborn blood spot test, and it's little things like trying to take the neatest newborn blood spot test, and a little competition over the 2 weeks between the 4 students, which I won in my 2 weeks. We'll just put that out there. I got my little proud peacock badge, and it's things like that, little celebrations, and challenges to set us, such small things that can kind of just really make you focus on a task. And I just absolutely loved working at the SMiLE clinic. It was an incredible opportunity to consolidate all my postnatal kind of skills. I was really lucky that I'd done a continuity of care, a pilot scheme the year before. So I actually had been out with MSWs in the community doing checks and things, but some of my fellow students had been on the postnatal wards and they hadn't seen women at day 5 and at day, they'd seen a few at day 3, but they'd seen barely any at day 5 or at day 8 or 9, or at 10 or 11. They hadn't really done that further postnatal care. And I think that's sometimes when a woman's almost come out of that fog of post-birth and things settle and they realize questions they have, and they're like, oh, actually no, they are still asking me if I have any questions about this thing, and I do have questions, and a lot more comes up at that point. And the birth center setting, the just slightly less medicalized feel, and it's just so nice and calm, and we're able to take that time with the women to really find out what they need. It was really fantastic to be able to do it, and to be able to try and think about managing a clinic as well. So not only just going, right, okay, you're in here today, and here's some patients, off you go. It's this is your structure for the day. It was actually we need to build a clinic list. We need to have a look into their notes before they all come for the day. It's all the administrative tasks that we would be doing as practitioners ourselves when we qualify, that you don't think about in advance. You don't think about necessarily all these extra bits that go into it. And we were there and encouraged and supported through that to be able to learn how to do it. And by the end of even the first week, we were absolutely bossing it. We were having a great time. We kind of come in and get on with our clinic lists and be able to search it, and it just really build our confidence. I haven't heard a single dot of negativity about the SMiLE clinic from any of my cohort, or from the years below. They've all absolutely loved it, and I think it's flexible for not only third years. Myself, for a third year, I'd done quite a few postnatal checks, but certainly still had a lot to tick off. As Dana said, it's sometimes hard to get those numbers. And by the end of the SMiLE placement, I'd ticked all my numbers off. I was definitely done there. So it was fabulous to be able to do that. But the second and first years have said how interesting it is to get that insight into those postnatal experiences, and also see just some normal postnatal. We get some postnatal ward experience, and sometimes our women who perhaps go home just after they've had the 4-hour post pre and postnatal sats, they go home 4 hours post birth or 6 hours post birth, and you're not going to see those people on the ward. So nice low risk women and their low risk babies, we're not necessarily seeing those on placements in the wards. And sometimes when we're out with the MSWs, that's our higher risk social women, with the extra support teams and continuity teams. So this is just a really lovely opportunity to see what normal is a little bit and give us that baseline of normal. So that then when we did pick it up, on those days, I remember we had one day where we had, I think, a jaundice referral and 2 extra low birth weight extra low weight referrals in one day, and we thought it'd all kind of come on us on one day. But it was really evident when it came up, because we saw it and we're like, actually no, this isn't normal. We know all this equipment works, we know everything's fine. And we knew that we had to do those referrals, and we were encouraged to do those referrals ourselves. Again, experiencing how to do those referrals, how to make those phone calls to certain teams and say, can I check this through with you? Rather than just, oh yeah, no worries, I'll call them. It's everything was really, the onus was put on us building our learning, and we were encouraged if there was a gap, what do you want to learn about, what do we want to be doing, and we just had fun. It was, it was really good. Yeah, I can't speak enough for it. It's absolutely something that should be integrated, I feel, across universities across the country. It's a fantastic way of learning. So yeah.
Oh, thank you, Sam. Thank you. And that's what we're striving to do. That's what we're striving to do. We want the students to have a really meaningful experience, but we want to make it a little bit fun. We want them to make it memorable, so they carry on those lovely behaviors in care, when they become qualified practitioners as well. It's really, really important. Hopefully we also lead by example, and we encourage the students to start thinking about what they want to be like when they're practice supervisors as well, especially the third years. So we sort of segregate it into first, second and third years. First years, it's an introduction to postnatal care. The second years, we're sort of pushing the boundaries a little bit, getting them to think about managing, getting them to think about the more complex cases. So I try and align it perhaps with the curriculum that they're learning at university as well. And also the third years, we definitely want to push them towards a little bit more leadership. They have that year as a preceptorship, and then they become band 6, which has an element of leadership within it. So hopefully, they will feel more prepared. We do a lot of work as well with the wider team in the practice education. So I work with a lovely midwife called Jen Lancaster, who is the preceptorship midwife. So she's looking at preceptorships now. She feeds back to me, Dana, actually, what some of the students or the new preceptorships are finding difficult. If I can try and implement something in the SMiLE clinic, I will do that. So perhaps make those students a little bit more confident when they hit a qualification. And also a lovely midwife called Dan Fremantle, who does workforce planning as well. So she's looking at retention, and that's really important as well. So this is not just stands alone, this is part of the bigger picture. And we're very keen to sort of feed in and do our bit to try and help the service as a whole, really. Service user feedback has been phenomenal. We have had 99% rated it excellent, which was the top, and 1% rated it very, very good. And they all felt well cared for. They felt that they were given respect and dignity. They loved the information given, and there was no negative feedback, which was just absolutely delightful. So we must be doing something right. Also, what I did a little bit of thematic analysis, from those feedbacks. We like the little bit of an academic came out in me, Sue, and what the service users were saying, that they loved the information given, the communicating of care. They all sort of said we were so really friendly but professional, so that sort of lent it to that professional friends that you hear a lot of midwives being called. Validating feelings and experiences, they felt listened to, which was really, really important. And they felt that we cared, because we do care about their experience, and that we understood what they were saying to us. And then from then, if some people did need that extra support, we could signpost them, and we could do the appropriate referrals as well. So again, not going to read all of this out, but this was just some of the feedback that we had from the women. So when the women do get discharged from the SMiLE clinic to go back into the community to the health visitor, they all get a certificate thanking them for being part of the student learning journey, and they are absolutely thrilled, and they get a sticker as well. So it's baby's first ever certificate. We include dad, mum, partner and baby. They get a lovely certificate saying thank you, because without them the students wouldn't be able to learn. So it is very much again like a little collaborative little community of practice, and they are very much part of it. And we do really want to thank them for that. The students also get a certificate, to put into their portfolio, saying that they've participated in a placement in a student-led clinic. And as Sam said, we have a couple of little competitions. We always have the best blood spot. We have the Proud Peacock Award for that excellence in clinical technique, as we call it. And as you could see, that was an absolutely superb newborn blood spot test. And we see them all the time in the SMiLE clinic. So, yeah, we have high standards. We have absolutely high standards. And also, you know, from the practice supervisor feedback is I work alongside two fantastic midwives, Sian Fitzpatrick and Penny Newell. And the reason why we like to have a few midwives running it in the week is that it gives students different practice supervision styles. Okay, because they are going to work with lots of different people. And also, I just think, you know, from a practice supervisor, you learn a lot from your colleagues as well as the students. And I think it keeps us fresh. There's new ideas coming in. And I think that's really, really important, not to remain stagnant. You know, we don't want to cruise. This needs to develop and evolve every step of the way. But I just want to say, you know, it's been an absolute pleasure from my perspective. I feel that it's a real privilege to share knowledge and learning with the next generation of midwives. I had a great experience, and I want every single one of the students that comes through the SMiLE clinic to have a great experience too. A couple of benefits and challenges. Okay, again, as you can see, you know, the benefits is the learning. You know, this is a project is all about education. It's educationally focused. It's not about bridging gaps in staffing, you know, and I'm really blessed that Emma Northover, our Director of Midwifery, had that vision. She's made that very clear. She was on side, you know, when we delivered this presentation. So everyone that is behind the SMiLE clinic knows its primary function is education. Okay. And, you know, we've got some quite strong characters that really safeguard that, put those boundaries in place. The students come first. And the reason the students come first is because if we deliver good education to students, they will deliver excellence in care. You know, that's how it rolls on. If we don't teach students, you know, quality care, and postnatal care, as we know, has suffered for many years, then the women won't get it. Some of the challenges that we've had is change management. Anyone that's probably undertook a project, trying to get people on side, and also, you know, from doing it from the ground from the root upwards is quite difficult. You do need perhaps a senior manager on side to really sort of help that project along. So we've had, you know, it's been quite tricky because I'm not a senior manager. It's been quite tricky over the years to be able to do that. Obviously, you know, there's sometimes gaps in the service when students are off. We have to think a little bit differently about that. And at the moment, it's only being offered in one sort of area placement, and probably one of our biggest problems, you know, is funding. You know, it is all about the funding. It's making sure that there is a midwife, but it is absolutely cost effective because we see a lot more women because we can. So one midwife can cover 2 clinics with the students, so we can double the amount of women that we're seeing. We have the bodies to do that. And that's been quite evident in our postnatal care, hence some of the beautiful feedback that we're getting. So it is working. And the future of SMiLE. So it is flexible. It is absolutely flexible. It has a flexibility to move to different locations. It works around the wider service, whatever that looks like, you know. It's so, I think if you're thinking about, can I give it a go in my service, I would definitely start with perhaps a postnatal clinic, something a little bit lower key, and then work up. It's adaptable. It can be adapted to different roles and responsibilities. So, you know, we could think about antenatal clinics, booking clinics, parent education, breastfeeding groups. And hopefully even one day, as they have in the States, they have dedicated education units that students run like a mini hospital, really. It's quite phenomenal, some of the things that they've picked up from in the States as well. As I said, the core value of SMiLE must remain in education. And you know, like I said, I don't want to keep repeating it, but I feel so strongly if we get the education right, these midwives will deliver first class care for our lovely women that deserve it. And I think even more so now I've got a daughter that is 15, you know, it won't be long. Perhaps in the next 10 years, she could be, you know, in the system. She's the next childbearing cohort. And I would only want the very best for her. And I think that we are collectively in a position that we can be a real advocate for education and keep our profession on the right lines. So that's the end of the presentation.
Well, I think